name's Justin Price, and I'm the creator of the BioMechanics Method, which provides corrective exercise education for health and fitness professionals. This video is part 4 of a 6-part series on understanding some of the most common causes of lower back pain. In this video, we're going to look at some of the anatomy that is affected by some of the upper body causes of lower back pain. Now, you remember in video 2 that we talked about excessive thoracic kyphosis and how that can cause lower back pain. So if we look at excessive thoracic kyphosis, it's a rounding of the upper back. So the vertebrae of the thoracic spine are moving into this posture. They're moving up, forward and away from the pelvis, which is where the erector spinae comes from. So the erector spinae comes from the pelvis, and the sacrum goes up, attaches to the spine, and then goes up further and attaches to the rib cage. So when the upper back is rounding forward, the erector spinae is crying on for dear life, holding on for dear life as that thoracic spine rounds forward. So it's not so much that the thoracic erector spinae muscles need to lengthen, they've actually become over-lengthened. They need to recognize that forward shift in the spine sooner so that they can shorten to keep the body upright so the lower back doesn't have to compensate to pull the spine upright. So in the thoracic spine, it's more of a problem that the muscles have become overly lengthened and they don't recognize that forward shift in the spine soon enough to help keep the body upright. That also applies to the scapular retractors and depressors. You remember that the thoracic kyphosis also makes the shoulder blades move forward and up on the rib cage, and that also makes the arms internally rotate. So the scapular retractors like the rhomboids and lower traps help bring the scapula back and down. Now over time, if you've had excessive thoracic kyphosis, those shoulder blades have moved forward and up on the rib cage, and those muscles of the rhomboids and lower traps have become overly lengthened, and now what happens is they get used to being in that lengthened position. What we need to do is retrain those muscles to pull the scapula back and down, which will obviously accompany this more extended thoracic spine position. Now, one muscle that you might not think about is the biceps. Now, we know from traditional anatomy that the biceps flex the elbow and supinate the forearm. However, when you walk, the biceps do the opposite. They actually slow down elbow extension and pronation of the forearm. Now, the biceps come from, well, the long head of the biceps comes from the forearm, it goes all the way up and attaches to the front of the scapula. So when you're walking and that forearm goes behind you, if the bicep's not long enough, the scapula is actually going to follow the forearm and come down and forward. And if you can remember back to the second video, is that scapula needs to go back to be able to rotate the rib cage to turn on all the muscles that help decelerate stress to the lower back. So if your bicep isn't long enough, your scapula is going to come up and forward, your glenohumeral joint is going to go forward, and your rib cage isn't going to rotate, and your thoracic spine is not going to stay extended. One more muscle you might want to think about is your obliques. So your obliques, all those side crunches you're doing to strengthen your obliques, have you thought about they actually need to be lengthened to enable your thoracic spine to stay extended and rotate? So an excessive thoracic kyphotic posture is actually shortening your obliques, and all those oblique crunches are making them shortened rather than enabling those obliques to be able to lengthen, which enables the scapula to retract and that arm to go behind you and turn on all the muscles which decelerate stress to your lower back. So that's just a little look at how some of the muscles of the upper back were being influenced, are being out of alignment through these other postures we talked about in the earlier videos 1 and 2, and how those muscles can actually cause lower back pain and stress. In the next 2 videos, we're going to look at some exercises you can do to help address these problems and decrease stress to the lower back. We'll see you then.